primarily my job is to make sure that other people are doing their jobs. But I like to spend most of my time kind of out and about with the different employees and with spending time with patients and kind of talking through things and laying my eyes on other things. And then lots of meetings around quality and care and patient experience. History tells us that marginalized people, immigrants and people of color have not necessarily been treated equally when it comes to healthcare and having healthcare rights. And so knowing that it's a generational thing, and the only way we can fix that and get in front of it is to show people, the ladder, show them that things are getting better and that this is a place where you can come and you don't have to worry about that. But I think it's a fair assumption, it's a fair fear to have. But we can't fix it unless we do the work. But there's 70,000 people in West Louisville. Not all of them look like me. It's all walks of life. The name of the game in this hospital is access, and so we needed to bring healthcare closer to home.
There's no question that there are benefits to having a hospital in the West End. You want to be able to have quality care as close in proximity to people as you can get it. And so the West End is a huge area of town. And so having a hospital sitting there for people to be able to access is incredibly important.
Of course, the naysayers, they're pretty shocked because people are actually using it. We had a lot of people that thought that the community would vandalize the building or people would breaking into cars, all of the stereotypical things that you think happen in West Louisville. None of that's happened. So from the time we've started construction till this day, we have never had anybody break into a car. We've never had anybody try to vandalize the building. We don't have trash laying around. Nobody's ever been attacked or hurt in the parking lot. I think our community respects this hospital.
In a community that is, and I think this is the important part that Norton has done, that is really designed to serve that community specifically, is really important because it means that those folks are going to get the services that they need.
We did community surveys and made sure that people had a voice and that they could decide what they wanted to see in the hospital. So you see this artwork behind me, you see the one across from me, the one on the wall over there, there's another one on this wall. When you first walk in, that pretty one with the girls with the butterfly on the back, it's all around the hospital. Those are local artists from Louisville, more specifically in West Louisville, that we contracted with to do the artwork in this building. We talk about the natural light you see when you first walk in. All of the rooms on the floor have 9-foot windows in them, and they have green space on the outside, a centralized greeting area. Those are all things that the community told us that they wanted that we were able to implement into the building.
How care is given and provided. And so one of the things about healthcare in general that we've seen in this country is that part of the thing that drives disparities in healthcare has to do with the quality of treatment and how certain communities receive a certain type of treatment versus others.
The level of trust and how shocked people are at how nice and friendly the place is. I think people just expected because it's in West Louisville that it wouldn't have the same Norton healthcare feel, or it wouldn't be as customer service centric as it is. When you walk in here, it doesn't necessarily feel like a hospital, and that was something that was important to us. You needed to feel comfortable coming in here, not just steel everywhere, and then not being warm and fuzzy. Like there's actually decor and there's color in the seats, and like it actually feels like a place that you want to come. But I mean, it's a beautiful building. You could pick this up and put it anywhere in our state or anywhere in our country, and anybody will want to go there.
They have been really intentional about building a space that is going to be specific to the community that is most likely to use it. And that means and that's a really big deal.
But for people in West Louisville, there's somewhat of a gap in care because you don't have doctor's offices down here at the time. Getting somewhere via a bus is 45 minutes. If you have to walk, it's even longer. And just considering transportation and access to care when somebody is truly, truly sick, it could be the difference between life and death.
That it's really about access is the big thing. And I think there are some people who may look, people like me, for instance, who is from a city like Houston, that's huge. And they may say like, well, the West isn't that far from, where the big Norton Hospital already is downtown. But in a city that doesn't have great public transportation, it has, quite frankly, terrible public transportation infrastructure. And in a city where there are a whole lot of people who don't have personal rides, so they don't own their own car, then accessibility to something like medical care becomes really, really hard. It's very, very difficult to access. And so you really want to get as close to the people as humanly possible.
That additional people will utilize the access that we have here, and that same customer service and that same patient care level stays where it is. So it's new and shiny now, and I think people expect for it to kind of dim down, once the lights and cameras are gone. But a lot of the lights and cameras are gone already, and we're still doing good. We can have this conversation a year from now, and I want the same experience, the same feel when you come in here to be the same, and more patients coming.